Hi guys, this is RN Tracy, 2MD, and I have my friend.
Hi, I'm Layla, also a med student.
And she has agreed to be my patient so that I can show you the actual clinical part of doing the Osce. So I already did the didactic part, so that would be in the part 1 of the video series. So now I'm going to show you how to actually do all the things. So we're going to start from the very beginning. So now it's going to start, and you'll see how to do the Osce. So I'm coming in and I'm doing my hand hygiene. Hi, my name is Tracy, and I'm a first-year medical student. And I've been sent, Tracy Epiakuvi, sorry. And I've been sent in by Dr. Who to come and take your vitals. Would that be okay?
Great, yeah. Thanks. Nice to meet you, Tracy.
Thanks. And is it possible for me to get your first and last name, please?
Yeah, my name is Layla Hammond.
And Layla, how old are you?
I'm 28.
Okay, Layla. So thank you so much for allowing me to take your vitals. I just want to make sure that I let you know that anything that we do here will be shared with your circle of care, including Dr. Who. And in the case that there's a chance that you can harm yourself or there's a chance that somebody else might be harmed, I might have to break confidentiality. So is it okay if I get started?
Yeah, okay.
So now I'm going to do the general inspection. So on inspection, it looks like Layla is her stated age. She looks appropriately dressed for the weather. So she's dressed in a sweater and it's a bit chilly outside, so that's okay. She doesn't look like she's in any kind of respiratory distress, and it doesn't look like she has any jaundice or any skin conditions. So she looks like she's pretty comfortable right now. So I think it would be appropriate for me to go ahead and get started with my vitals. So I'm going to first get started with doing her pulse, and then I'm going to move on to taking her blood pressure. So I'll go ahead and get started. Okay, so the first thing I'm going to do is take both of your hands, and then I'm going to locate her radial pulse. So that's just going to be along the side of her thumb on both sides. So now I'm palpating both pulses, and I'm not looking for a time. I'm just making sure that they're both equal. So both of them are equal, so I would give it a 2+. So now, is it okay if I take your left hand, Layla? Perfect. So now I'm going to have a look at my watch, and I will be measuring your pulse for 1 minute. Okay, thank you. And so her pulse was regularly regular, and the rate of the pulse was about 80. So that's within normal range. So yeah, so it was regularly regular. And as we said before, it was a 2+, and it was equal on both sides, which is what we're looking for. And the thing I didn't tell Layla is that while I was measuring her pulse, I also was measuring her respiratory rate, and her respiratory rate was about 12. So a little bit more, it's a little bit slow, but I think it's okay because she seems pretty relaxed and she doesn't look like she's in any kind of respiratory distress. So I'm going to now move on to taking her blood pressure. All right, so now we're gonna go on and I'm gonna be taking your blood pressure. And so just before we start, I need to ask you, Layla, have you by any chance had caffeine in the last 30 minutes?
No.
Have you by any chance smoked in the last 30 minutes?
No.
And have you done exercise in the last 30 minutes?
No.
Amazing. And Layla, I just noticed that you're sitting with your legs crossed. Is it possible that you can uncross your legs?
Oh yeah, of course.
Amazing, thank you. And is there a specific arm that you'd like me to use for your blood pressure?
You could use whatever one you want.
Okay, I'm gonna go with your right arm. So the first thing I'm gonna get you to do, Layla, is can you flex for me? Perfect. And right now I'm gonna be palpating just at her bicep tendon, and then can you relax? And as she relaxes, I'm able to feel her brachial artery or her brachial pulse. And so I'm going to keep it there. And then 2 fingers above that is where I'm going to place my blood pressure cuff. And I'm just going to make sure it's nice and snug, but not too uncomfortable. Layla, is that comfortable for you?
That's great.
Amazing. Okay, I'm just going to get you to relax your arm there for me. Okay. And then the next thing I'm going to be doing is making sure that this is righty-tighty. So it should be right, but not too tight, just enough so that I can inflate the cuff and release it as I need to. All right, so I'm going to start inflating the cuff. I'm just going to be palpating for her radial artery and noting when it disappears. Sorry. Good. There we go. Okay, so it seems to have disappeared, and right now I'm at 160. I'm going to slowly release by 2 millimeters of Hg per heartbeat. And I notice it reappeared around the 110 mark. Okay, so now I'm going to just let your arm relax for just a brief moment. I'm going to, again, righty-tighty, so it's ready for my blood pressure when I take it. Now it's time to put on my stethoscope. First, I should locate again the brachial pulse. I'm going to place the diaphragm right below the cuff. And I will inflate. So I inflated the cuff to about 30 millimeters of mercury above the estimated value. So I inflated the cuff to about 140, since I'm estimated to be 110 for the systolic. And I found her systolic blood pressure to actually be 120, which is perfectly within the normal range. Good job, Layla. And then I found her diastolic blood pressure to be 77. So that's also right around the perfect range. So what we're targeting, of course, for blood pressure is 120/80. So that was right within the normal range. If it had been above 139 for the systolic blood pressure, I would have said that she was hypertensive. And if it was above 90 for the diastolic blood pressure, I would have also said that she was hypertensive. But she was pretty much perfect. And so, yeah, and as I was listening, I made sure to reduce deflate the cuff by 2 millimeters of mercury per heartbeat. So perfect. Thank you so much, Layla.
Thank you.